According to reports, those manning the hotline have received almost 300 calls since its launch on February 1st. The service has been set up to help those with emotional challenges or people struggling with other issues. However, Minister of State in the Ministry of Health and Wellness, Davison Ishmael, says it is currently accessible only during the hours of 2 p.m. to 6 p.m. daily.
And right now is operating on a very limited length of time per day because of, we started it as a pilot. We want to see how things will go on the uptake. And I've heard from the team just recently that there is an expectation that within the coming weeks that we're going to be able to extend those hours to 24 hours a day because the demand and the uptake has been good. And not only demand, but of course the responses that we're getting, and because of the interventions that we're making, persons have reported to us that this has been a very useful avenue through which they were able to get some assistance.
The minister was speaking following the opening of the Mind and Body Gym at the psychiatric hospital. Management and staff at the hospital are working on improving their own mental health through fitness, an initiative Mr. Ishmael supports. He's also disclosed plans to review the mental health legislation.
We therefore, as a contemporary and a progressive administration and government, we're in the process right now of undertaking a thorough review and modernization of that legislation because, of course, people have changed. We have evolved almost as a species, and we want to be able to ensure that our legislation is in keeping with where people are right now in terms of mental health awareness, etc.
Meanwhile, nursing officer at the psychiatric hospital, Ryan Lewis, says coming out of the COVID-19 pandemic, more people are accessing mental health services.
Anecdotally, I don't have the exact figures, but I can say coming out of COVID, we have seen an exponential increase in traffic of persons accessing these services. It would be a better gauge to deem if the services are independently sought or if persons are actually being referred, because we want both sets of things to occur as well. We want mental health to be a service where it's likened to that of dental care and polyclinic care, where persons do a check-in ever so often throughout the year, 2-3 times a year, and not wait until issues deteriorate to the point of you almost hitting rock bottom.
Officials are advising individuals who need support for their mental health issues they can get assistance at the 9 polyclinics and the psychiatric hospital. Lorna Jones, CBC News.